Matt Del Vecchio here. Gray Oncology Solutions is using artificial intelligence to provide cancer patients with a sort of roadmap, a ways of healthcare, if you will. Since its creation, there's been a 5 to 10% increase in the number of patients seen, a 17% reduction in wait times, and an 80% reduction in administrative workload. The motivation behind it all, reducing the stress of oncology patients between treatments. Well, joining me today to speak about the software is André Diamant, CEO of Gray Oncology Solutions. André, welcome to Life Unrehearsed.
Hi there. Thank you. And thank you for having me on.
Well, thank you for joining me here on Life Unrehearsed. Fascinating AI helping out cancer patients. Tell us a little bit about Gray Oncology Solutions.
Yeah, absolutely. So we're a startup based in Montreal. We're a few years old. We're one of these COVID companies, if you will. Actually, I'm an academic by background, and so is sort of the founding body of the company. It's a pair of PhDs and a trio of professors from the area. And really, just as COVID was hitting, we were looking at wait times in hospitals, wait times particularly in cancer care, and just the complexity of all the scheduling and resource allocation that has to be done to treat patients effectively and efficiently. And it seemed like a problem that just wasn't being addressed appropriately by the incumbent software providers. So we partnered with a hospital here in Montreal, the CHUM, and set out to build something to really help with that.
Well, it's so important. We're hearing it more and more on the news about longer waiting times and just the admin of dealing with scheduling. And so exciting how you're incorporating AI into it. So tell us more about what inspired you to create this.
Yeah, so there's a couple points I can make here on just a personal level. Frankly, through our academic career, and perhaps on articles that you read online, on shows such as your own, you see a lot of research that seems super promising. It seems like it really could make a difference. And then unfortunately, a lot of it never actually translates into real clinical practice. And there's a number of reasons for that, which is a much longer discussion. But we really had this desire to see if we could do something about that. Could we really kind of make that last mile step and translate research into clinical practice? And then just on a problem point of view, quite frankly, I don't think I've ever had a medical appointment short of maybe a dentist appointment that actually was at the time that I was told it was going to be at. And we all know the pain and stress, particularly for something like cancer, where if you're sitting in a waiting room for 45 minutes, there's other things that you could be doing. So again, we really just wanted to try and build more robust, reliable schedules with shorter wait times altogether.
Talking with André Diamant about how AI is being used to help cancer patients here on Life Unrehearsed. Now, André, can you give some real examples and benefits of the kind of software that you have at Gray Oncology that can benefit oncology patients in hospitals?
Yeah, so we're used across a few provinces and into the States now in about 10 hospitals. And some of the impacts that we're seeing, first on the patient side, as you mentioned at the top of the show, seeing anywhere between 15 and 20% reduction in wait times. A hospital in Ontario actually is seeing the best wait times that they've seen in decades. And this is in part just due to building these more effective schedules. So that means getting patients into their treatments quicker, which especially with a progressive disease like cancer is, of course, critical. On the provider side themselves, they're seeing just increased access to care. So with that reduction in wait times comes the ability to bring more patients in, and also that reduced administrative burden, where right now, sort of the norm, if you will, is you have a number of individuals who are really doing these Herculean tasks, jumping through hoops day in, day out to deal with stressful changes in schedules and kind of trying to play this multidimensional game of Tetris. We try to really help them with that, reduce the time that they have to spend doing that so they can spend more time with patients face-to-face, talking to patients on the phone, what have you, rather than trying to jump through these hoops. So that's the reduction in administrative burden that you were alluding to earlier.
Sure, yeah, you could see that clearly. And going back to the families and the individuals, how stressful it is alone just dealing with cancer and then having to get caught up in the admin part of it and waiting for time. So AI is developing so quickly, André. You're at the forefront of this. Where do you see this software developing in the next 5 years?
Yeah, so the main sort of, let's say, vertical that that we're going to continue to develop the software into is across the entire cancer care continuum and then actually beyond. So we're speaking more specifically about cancer today, but many of us know that this isn't just an issue unique to cancer. When it comes to scheduling and when it comes to resource efficiency in hospitals and having patients receive care as quickly as possible, that's not unique to just cancer. So first off, we're expanding along the entire care continuum in cancer. So that's including things like imaging, diagnosis, the first physician consult. So we can really have a high-level roadmap where you can be scheduled in one software across that entire trajectory, and then eventually expanding into other areas of healthcare, radiology, cardiology, endoscopy. Those are a few of the other areas that we're exploring right now.
Very interesting. Listening to Life Unrehearsed, Matt Del Vecchio here, and I'm with André Diamant, who's the CEO of Gray Oncology Solutions. We're running out of time, but very quickly, we've heard, I'm going to put you on the spot here, André, but we've heard Santé Quebec is just starting. You mentioned you're in different hospitals. It must be a challenge, I guess, as a private company trying to break through into the public sector, yet offering tremendous efficiency. So how is that working out and playing out?
Yeah, you're absolutely right there. It's not the simplest market to sell into, and certainly this is my first company. I'm still relatively young, and if you had told me that selling into the government was going to be the first place I'd go, I'd probably say no, thank you. But it's ended up working out quite well, and the reason for that is due to the hospital partners that we've managed to partner with here in Montreal. Have really championed the software and helped us make sure that we're taking into account all this clinical nuance. And through them, it's then started to spread across Quebec. We're in 5 hospitals in Quebec now, I believe.
Nice.
And that has now started to reach somewhat of a critical mass where it's allowed us to, not formally, of course, but to have at least a seat at the virtual phone call with folks such as Santé Quebec to try and see if we can really spread this beyond.
You've got a little credibility established. It's not pie in the sky stuff. This is real. So glad and wishing you a lot of success with this, André.
Thank you so much. I appreciate it.
Thank you. That's André Diamant, CEO of Gray Oncology Solutions.